Bismillah ar-Rahman ar-Rahim. Hello everyone. I hope you all are doing well. This is the second lecture for the Critical Thinking and Evidence-Based Practice class. I know some of you talked to me about speaking in Arabic in the presentation, but I really think that it is more beneficial if the presentation is in English. I will speak very slowly. And please send me an email if you still can't follow the lecture. All right, let's start. What did we learn last time? Remember, in the last lecture, we talked about the fact that not all patients receive treatment according to the latest scientific evidence. But many patients, if not most patients, receive treatment according to personal experience, according to authority, and according to traditions. We also discussed the drawbacks of practicing in such manner. We talked about the problems that can happen if we keep practicing according to traditions. We also talked about why clinicians don't use the scientific evidence, and we concluded that it is basically because they either don't know how to find the evidence, or don't have time to find the evidence, or they don't have the skills and they don't know how to go about finding the evidence. And I presented quite a few studies to demonstrate that. Another study I would like to share with you is a study on physicians. They asked physicians about their knowledge of what is the best way to care for patients with hypertension. This diagram is depicting the results of this study. The x-axis is showing the number of years since graduation. The y-axis is presenting the knowledge about treating patients with hypertension. As you can see on the x-axis, this is 5 years after graduation, 10 years after graduation, 15 years after graduation, and 20 years after graduation. As you can see that the knowledge of best hypertension care decreases as the number of years increase. So there is a negative correlation between knowledge and number of years. When one decreases, the other one increases. As you can see, the correlation coefficient, if you remember, معامل الارتباط, R, is minus 0.54, and the p-value is less than 0.001, means it's a very significant relationship. So this confirms what we're talking about, that after graduation, as the years go by, our knowledge starts to decline. I'm sure this is true of many, many other conditions, not just caring for hypertension. Remember last time we talked about the importance of incorporating scientific evidence into the clinical decision-making process. I also want to emphasize that knowing the scientific evidence is not the only thing that we consider. We also consider our experience and judgment. We consider the circumstances of the patient, and we consider the patient references or values. So all of these factors really add up to the best decision that you could take in your clinic for treating patients. To really find the evidence and to practice physical therapy according to the evidence, we must follow the principles and the methodology of evidence-based practice. The first step of evidence-based practice is to state the clinical question. What is your question? What do you want to know? And really asking a good question, a clear question, will help tremendously in finding the answer. After you determine your question and you ask a good question, and we'll talk more about this, you need to search for the answer, and that's by searching to locate the relevant studies, because you're really looking at studies that have been done on the same patient problem, so you can find the answer to your question. We must use explicit methods to determine which articles to include. As you know, if you want to, for example, search for treatment for anterior cruciate ligament tear, you can find maybe 500 articles in just the past 3 to 5 years. So which articles would you consider in your search, and which articles would you exclude from the search? After you find the articles, you want to assess the validity of the evidence. You want to make sure that the results are valid and that the conclusions of the article are based and supported by data in the article. After you do that, you determine the relevance of the findings and you apply the relevant findings to your patients. We'll go step by step through this process and see how it is applied. So how to? You start, first step, ask a defined clinical question. PICO is an acronym that was used to show or to summarize the 4 parts that we must use to come up with a good clinical question. P stands for population or problem. So when you look for the answer to your question, you want to determine what population or what problem you're looking for. So, for example, if you're looking for patients who are smokers with obstructive pulmonary disease, for example, that's the population. I stands for intervention. Intervention is an important word that we need to remember. Intervention, we used to call intervention treatment. Now the American Physical Therapy Association and the Guide to Physical Therapy Practice is using the word intervention to replace the word treatment, because the intervention sometimes is not really a treatment. It could be just giving the patient a walking cane or a brace or any other mean. So intervention or exposure is the service or planned action to be delivered to that specific population that you are interested in. C stands for comparison. Comparison means that you want to look for articles or to look for studies that have compared the approach that you are considering compared to either a different approach, a different intervention, or compared to people who received nothing. For example, in some studies, they used laser, for example, hot laser or cold laser, and found that patients who received the treatment improved as much as people who did not receive the treatment. So this is a control group design. O stands for outcome. And outcome is another very important word that is used to depict the way in which you can measure the results of your intervention. So you're going to treat the patient. What are you going to measure to make sure that your treatment made a difference? The outcome could be range of motion, could be muscle strength, could be level of pain, could be girth measurement for swelling, could be anything. So asking a defined clinical question must include the population, the intervention, comparison if possible, and then the outcome that you are going to use to measure the effect of the intervention. Benefits of asking a good clinical question, a thoughtful clinical question: it makes it easy to define the terms for the search. So when I go search for articles, I want to narrow my search to the specific question that I'm asking. Also, it helps to combine terms needed to represent the required information. For example, I want women with ACL tear who are athletes. So I want to look to the articles that only address women, athletes who had traumatic anterior cruciate ligament tear. If you have a good question, where would you go to look for the answer? Well, you can go to many places, and we will discuss how to use each of these resources later. But there are several search engines and resources that you can use. For example, Ovid, PubMed, SumSearch, EBNet, and you have the websites for those, and we'll go over those again. We have quite a few databases. Medline is probably the most famous. It is very old, and it is produced by the National Library of Medicine in the United States. And it was computerized in 1966. It covers mostly peer-reviewed American journals. Peer-reviewed means that the study was published after it has been approved by experts in that field. So at least you know that the article has passed through editors or reviewers who are experts in that field. It also uses an indexing thesaurus called the MESH. MESH stands for Medical Subject Heading. So you can search for any medical subject heading. For example, if I want to search for slipped epiphysis of the femoral head, if I want to look for supraspinatus tendinitis. So I'm looking for something. You can also look for big things like anatomy and pathology and things like that. But usually it is better to look for specific titles. CINAHL is another database that is more for nursing and allied health literature. It is mostly, again, American journals. It focuses on occupational therapy, physical therapy, speech therapy, and so on. You need, before you go to these databases, you need to formulate a search strategy. You need to think about the keywords for each of the PICO parts of the clinical question. Remember PICO, the problem, the intervention, the comparison, and the outcome, the measurable outcome. This is an example of how to apply this. This is a clinical question. Is prophylactic preoperative physical therapy for patients undergoing upper abdominal surgery effective in preventing post-operative pulmonary complications؟ بالعربي، لو أنا قدمت للعيانين pre-operative physical therapy قبل ما يعملوا العملية اللي هي upper abdominal surgery، هل ال pre-operative physical therapy ده هيمنع post-operative pulmonary complications؟ So that's the question. لو جينا بصينا للسؤال ده وطبقنا البيكو parts، for example، ايه ال patient population اللي أنا هدور عليها؟ patient population هي ال patients اللي هيعملوا upper abdominal surgery. يبقى ال keywords بتاعتي upper abdominal surgery for population. ال intervention أو ال treatment اللي هو prophylactic physical therapy قبل العملية. يبقى ال keywords اللي أنا لازم أخدها معايا عشان وأنا بدور prophylactic physical therapy. If I find the studies that did comparison, then the comparison should be patients who received the prophylactic physical therapy compared to patients who did not receive prophylactic physical therapy. صح؟ The outcome, pulmonary complications. Yes or no? If they had pulmonary complications or did not have pulmonary complications. The type of study to look for, the best type of study to look for is the RCT studies, and we'll talk more about this. That's the randomized control trials, and I'll tell you what that is in a minute. There are many kinds of studies that are used and many research designs that are used to try to answer research questions. These designs are not equal. Some designs are better than others. This is the hierarchy of evidence for clinical questions. Hierarchy means it is arranged according to its importance or its value. So number 1 is better than number 4. Number 2 is better than number 3, 4, 5, and 6. Number 3 is better than number 4, 5, and 6, and so on. Meta-analyses is number 1 or on top of that pyramid. Systemic reviews, and then followed by randomized controlled trials or RCTs, then controlled comparison or case control study, descriptive surveys, and case studies. Let's go one by one and see what that is. Systemic reviews and meta-analyses don't look at one study. They look at several studies. For example, would a group exercise program improve balance in older adults? Well, in systemic reviews and meta-analysis, they look at all studies that have been published on the topic in that population, and they try to summarize the results of all of these studies and come up with a conclusion. The conclusion could be a summary of the results, or it could be a summary statistics. So the meta-analyses, it's a method of synthesizing the data from more than one study, usually quite a few studies, like 15, 20, 30 studies, in order to produce a summary statistic. So at the end of the meta-analysis, and by the way, this is usually done by a panel of expertise. مش الواحد لوحده بيعمل الميتا analysis. Usually بتبقى مجموعة expert في subject. They establish criteria for the studies, and they read all the studies that have been published on the topic, and then they summarize the results, synthesize first, يحلل الأول وبعدين يلخص results. وممكن يقول لنا في الآخر what to expect من الجروب exercise, group balance exercise in older adults. هيتحسنوا ايه اللي هيتحسن وهيتحسن بنسبة قد ايه. السيستماتيك ريفيو نفس الحكاية، بس بتدينا information أكتر عن الميتا analysis. برضو هتبقى to answer a clear, let me get the pointer, the highlighter, to answer a clear question by finding and describing all published and, if possible, unpublished work. So it's trying to gather all information on the topic. It uses explicit methods to perform a thorough literature and critical appraisal of individual studies. يعني بتستخدم طريقة محددة في قراءة الستاديز دهيا، وإنها تقيمها وبعدين تعمل عليها statistics على الأرقام بتاعة الستاديز دي كلها، وتدينا الملخص بتاع كل الستاديز دي. من ده نعرف ان السيستماتيك ريفيوز والميتا اناليسيس، لانها بتبص لستاديز كتيرة جدا، فعلا بتبقى احسن من استادي لوحدها، وبتديني معلومات اكتر عن التوبيك اللي انا عايزة اعمل له study. Now we come to the randomized controlled trial or RCT. دي من احسن الستاديز اللي ممكن تتعمل، اللي بتدي نتائج نقدر نثق فيها. This design depends on random assignments of subjects to groups. Random assignment means that I assign people randomly to either group A or group B. أو C أو D, depends on how many groups I am studying. And these groups are given different interventions to assess the effect of the intervention. مثلا لو أنا عندي 50 عيان، هقسمهم ل 2 groups. Remember التقسيم هيبقى random. جروب هياخد treatment A، وجروب إما هيبقى control group أو هياخد control أو هياخد treatment B. ممكن يبقى فيه جروب C ياخد another intervention. هقدم الانترفنشن، هعمل follow up، همجر الريزلتس وهكمبير الريزلتس. الديزاين ده لأن الناس بتبقى randomly assigned للجروب، بتقلل البايس أو الخطأ اللي ممكن الواحد يقع فيه لو هو بيقسم الأشخاص وهو عارف مين هيروح جروب A ومين هيروح جروب B. يبقى randomized control trials is the best really design in finding the results. The cohort studies are studies that divided according to a specific characteristic. For example, هنا مقسمين العيانين للسموكرز والنون سموكرز. طب تفتكروا ليه ما اقدرش اعمل في الاستادي دي randomized control? Because if the person is a non-smoker, it is unethical to put him in a smokers group and ask him to smoke so I can do the study on the person. That would be unethical. So to study the difference between smokers and non-smokers, I have to divide them from the beginning according to that variable, which is smoking, and follow them over time and then compare the outcomes. In this case, I cannot do really a randomized controlled study. Case studies or case controlled studies is an observational study in which cases have the issue of interest. For example, if I get a patient with a rare condition, I don't have like 50 patients with that condition. I came across a patient with a rare condition. The only thing that I can do with this patient is a case study. But the controlled comparison or case controlled study is when you have several cases of that one condition. The case reports, for example, you got a patient and you did a report on that patient, another patient, you did a report on this patient, another patient, and you did a report on this patient. And you're going to compare the notes of these patients and you're going to publish an article that talks about this condition. This is not a very strong design because it really, your observation is based on one patient at a time. So the case series and case reports are important and are used when you have very few cases of a specific condition. Descriptive surveys are studies that describe, from the name it is describing, certain characteristics or attributes of a population, trying to understand the association between things. For example, if I'm doing a survey on young women who are smokers and then find that those young women who are smokers have, for example, more cases of breast cancer. It doesn't mean that smoking causes breast cancer, but it means that there is association between smoking and breast cancer. So descriptive surveys is try to come up with relationships between variables. Again, it is not a cause and effect. It is just establishing a relationship and testing a hypothesis. For example, before I start the study, I might hypothesize that أفترض that smokers have more risk or at high risk for a certain type of cancer. Again, case studies describe particular device or event focusing on unusual aspect of reported situation or adverse occurrence, commonly have exploratory, descriptive, or explanatory process. So case studies are not as strong as studies that are done on a big group of patients. Okay, I'll stop here, and I would like you to really study what we have covered today, and your assignment will be to come up with a clinical question using the acronym PICO and explaining how you are going to use the keywords for your question. Follow the example in the presentation, and please post your answers on the website for the course. All right, well, I thank you very much, and I'll talk to you again soon. Assalamu alaikum.